Hello everyone, my name is Landis Stocum and this is my integrative review presentation addressing depression rates among adolescents. Discussed within this presentation is the effects of treatment as usual versus cognitive behavioral therapy or addition of cognitive behavioral therapy with treatment as usual. As you know, depression has become an illness very well known to us all. Most of us know someone who suffers from depression, and in more recent years, many individuals have been reluctant to rely on medications to relieve symptoms of depression due to the many side effects that have been known to be associated with taking prescribed medications that treat depression. According to the United States Department of Health and Human Services, in 2008, 8.3% of adolescents experienced a major depressive episode. So just to be clear, this is not your typical intermittent feeling of the blues or having a bad day. A major depressive episode, according to the United States Department of Health and Human Services, is debilitating in nature and prevents the affected individual from performing activities for at least 2 weeks. So the goal of the United States Department of Health and Human Services was to drop that rate down to 7.5% by 2020. But as of 2015, that percentage has increased to 12.5%. These statistics should instill a spirit of inquiry within the advanced practice nurse and cause them to ask, why with current medical advancements are depression rates among adolescents on the rise rather than on the decline? Of note is the fact that the percent increase of depression rates among adolescents and the percent increase among adolescents in suicide rates is almost identical at 33 and 32% increases on those rates. And I don't think that this is a coincidence. So these statistics are very important, they're very startling, and they need to be addressed. So the question is, what is working? What research is showing that helps? And the answer is cognitive behavioral therapy. For those of you who don't know what cognitive behavioral therapy is, or CBT, it's basically designed to teach patients to recognize their negative or unhelpful thoughts, identify them as incorrect, and find solutions to those negative thoughts. The end result is a change in thinking patterns and a decrease in destructive thoughts and behaviors. CBT basically provides the patient with the tools to be their own therapist. It teaches them to recognize their unhelpful thoughts and change them. Because control is given to the patient, the Tidal Model of Mental Health Recovery is an ideal theoretical framework for the application of CBT. The reason is the Tidal Model promotes self-discovery and self-analysis. To quote Barker, the Tidal Model emphasizes pragmatic ways that people might learn what works for them and why, and to help people in their care to become aware of the small changes which are occurring to them and through them as part of their everyday reality. 2 recent studies involving CBT therapy show how well CBT therapy works. Lake, Wijnhoven, Creamer, Vermeulen, Schultz, and Engels performed a study in 2013 among adolescent teenage girls with elevated depressive symptoms. 102 females participated in the study, with 50 in the control and 50 in the intervention group. The intervention group in the study had significantly higher depressive symptoms at baseline. In the short term and at 6-month follow-up, the intervention group showed significantly lower depressive symptoms compared to the control group. The second study, performed by Clark, DeBar, Pearson, Dickerson, Lynch, Goulian, and Leo, performed a study in 2008 among adolescents declining antidepressant medications. There was a total of 212 adolescents that participated in this study from age 12 to 18. There was 106 in each groups. They were followed for 2 years, and brief CBT therapy was implemented into the intervention group, and the intervention group showed a rapid decline in depressive symptoms and maintained lower depressive symptoms at 2 years. So basically, both of these studies implemented CBT therapy into their intervention groups, and both of them found that CBT therapy was extremely effective. And I'll attach PDF files of both of those articles so anybody who wants to read those in more detail can do so. So the literature in these two research articles can be used to help nursing practice in several ways. Patients who don't want to take medications can be recommended to CBT therapy, and really CBT therapy should be recommended to anybody who is suffering from depression. And early intervention, early recognition, and initiation of CBT therapy is a very effective way to relieve those symptoms, and it's very cost effective, especially in the group setting. We can improve nursing practice and improve quality of life for our patients in a financially responsible way by educating them about CBT and their options. CBT therapy can be in the group setting, as I said before, and I think an ideal place for that to take place would be in perhaps the public schools, where adolescents are more prone to stay after school, participate in CBT therapy. They're around their peers which they would share commonality with, and they can discuss with their peers how well CBT therapy is working for them, and they can be like a little support group for each other. So basically, in closing, recent research has shown CBT therapy to be very effective. It's financially responsible and a more effective way to treat depression. It can also be implemented easily by advanced practice nurses, and with implementation can reduce depression rates among adolescents. CBT therapy works very well and can improve nursing practice and patient outcomes and improve quality of life. Thank you.